Well, currently we're focusing on patient-reported outcomes. Now, patient-reported outcomes, it's sort of focusing on that shared decision-making perspective, where the clinician and the patient both give inputs on the treatments that the patient will be taking. So we did this research where we found that when patients report that physical well-being is good, that's in fact more predictive than when clinicians are saying something else about their patient-reported physical well-being. And I thought that was quite interesting. Like, it's like, sure, everyone knows that's kind of true. Everyone knows their body better than, some other person, but it was good to sort of quantify and validate that with like data that we have. So that's like the main outcome that we got. And like, again, the focus is to sort of focus on more patient-reported outcomes, look at different domains of patient-reported outcomes, not just like physical well-being, but also look at social, emotional well-being and how that impacts their survival, and whether we can, sort of come into it and sort of intervene and, improve their social well-being, improve their emotional well-being as well. Because sure, the therapies are working in the background, but it's all about providing this holistic care to patients.
Yeah, I mean, Natandra's provided an excellent overview of what was found in the particular study that we have here. I guess it sits within a broader program of research around wanting to provide context around the importance of shared decision making and valuing the patient's perspective in clinical practice. So we were able to get access to a large sample of patients that had filled out systematically surveys over a long time as to their physical function, their emotional well-being, as well as then detailed information from the clinic around what adverse events and survival outcomes they had achieved when they'd started particular therapies. In line with kind of emerging research, we were able to provide contextualization in HER2 positive breast cancer, that, like it's been seen in other locations, that the patient-reported outcomes are just as important to appreciate as a clinician perspective. As part of a larger program where we're doing similar work in other subtypes of breast cancer and also other cancer types.
It's about giving patients personalized input. So like a patient wants to know how will this medicine work for them in particular. And like oftentimes the data and the literature is just about how it will work for a subset of population of patients. So I think it's about time we sort of tailor our counseling to that person sitting in front of us rather than just giving a broad perspective. And that's what some of the research that we do is we make prediction models and prediction tools where, like you sort of just follow just your normal characteristics, such as your race, your like baseline blood levels, and just to use that algorithm to, tell the patient sitting in front of you, hey, this is the medicine you're getting, and these are the chances of getting this particular side effect. And I feel like getting that patients feel more confident, they'll go, okay, now I understand, and sure, I'll take this medicine now.
I think it's probably time. It's probably time in the context that it takes years to learn all the different available treatments, and then it takes years to learn all the different available treatments and how they might be used, and being able to convey that information all in one clinical visit is impossible. What I think we need to do better with is communicating with patients and bringing in their perspectives on what information they actually want. And I think that's what studies like this show, is that if you can get the patient's perspective on a particular item, then you put yourself into a position to be able to give them the information that they need or that they want. It's not okay to just go, well, you can't train them in everything, so don't give them anything.
It's just about, getting the whole picture of the patient themselves, rather than just looking at their subtype of disease. So, people look at their subtype, all right, they have HER2 positive breast cancer. Let's treat them with HER2 directed therapies, right? And sure, like they work and they work quite well, and they will increase your survival. But then it's also about looking at the quality of life. So again, it comes back to this appreciation of patient-reported outcomes. Asking the patient how they're actually going, not just looking at some biomarker data, not just looking at the tumor size. Sure, it's reducing, it's working, it's good. But we need to be asking patients throughout the journey. It's like, how are you feeling? What are the adverse events you're getting? Like, are they affecting you? Is it affecting your family life? Is it affecting you financially as well? And there's this perspective about time toxicity. Sometimes patients get treatment and then they're hospitalized in hospital, right? So they're not actually enjoying their life. So again, it's just about focusing on that quality of life component that our research focuses on.
Well, I think we're in a really kind of exciting time where we're getting better therapies to treat cancer, better therapies to treat HER2 positive breast cancer, and that is meaning that we need a shift in the way that we design trials and then evaluate whether they're successful. When survival was shorter, obviously a very hyper focus is on what are the survival outcomes. But if therapies are working well, it's not enough to just say, oh, look, we achieved a 1.5 month survival improvement. It's not contextualized to an ability to carry out daily functions and adverse events. So we're in an exciting time where we have better therapies and we're developing better trials so that we appreciate quality of life outcomes and adverse events better than what we used to. I guess part of what we do in this group is about trying to improve methodologies for evaluating trials and then pushing pharmaceutical companies towards equally valuing both survival, quality of life, and adverse event outcomes, and they should all be valued the same and reported just as equally.
Well, HER2 positive breast cancer used to have quite poor prognosis associated with it. If you go back 20 years, 25 years, 30 years, but nowadays it's improving. The survival rates are good, and as we said before, newer and newer therapies are coming out. So it's not a death sentence that that used to be when we didn't have all these targeted therapies going on, but now we do. Again, it's still pretty horrible, but the survival outcomes are improving, and now there is this focus on quality of life as well, and hopefully we can sort of treat the patient, and newer therapies are coming out, and just keep supporting them. That's my advice to families, keep supporting them, because we said, there's other domains, physical well-being, emotional well-being, social well-being, functional well-being. All these domains can be helped by the family, just make that easy for them. But yeah.
Yeah, well, I guess this is just reiterating that there are many available treatment options, and many of them have been shown to be quite effective. So it's obviously not a diagnosis that anyone wants to have, but it's just making people aware that there are treatment options, and for the right individuals, they work quite well, and then there are support mechanisms out there for people to be able to communicate, particularly if they're not feeling the best. I guess even part of what we had in our research is just showing that whether it's correlated or not, a patient's kind of emotional status and how they're feeling and how well they're functioning and how well they're moving, that can actually make a difference to survival outcomes. So if there's many treatment options available, and a positive attitude is something that does help.
Well, again, my message to the health minister would be to just keep funding research. Hopefully there's no more cuts on research and just sort of increasing the budget the researchers can access to apply for in terms of grants. Particularly now, as we alluded to before, there's like newer therapies coming out, and now it's about time that sort of researchers in Australia are also able to access some of that data as well to sort of give like an Australian perspective on the treatments that are coming out, because a lot of these treatments are have patients that are enrolled in the US or in Europe. There are a few patients that are enrolled in Australia as well, but it's largely being driven by the data that is being collected overseas. But to me, I'll be saying to the health minister to sort of give researchers more money here to conduct more research on HER2 positive breast cancer.
I mean, it's a hard question for an individual to answer. So I guess when I receive that question, I'm inclined to answer it probably from the perspective of our consumer group, which we help to inform, and I guess then the objectives of our research team, which I think Natanj shows is not the only research that's being done. So there's a kind of a responsibility to broadly fund kind of research, because there's many possible and worthy initiatives that are being carried out. But from our group's perspective, I guess the things that we're working on that excite us are around trying to validate and then implement patient-reported outcomes into practice, because there's evidence around showing that something as simple as taking routine surveys and then having people monitor the responses and having that implemented in practice is equally as beneficial to survival outcomes as a new treatment. So I think that just makes sense, that if you can do something that's a survey and achieve the outcomes that are equal to a medicine, which obviously has substantial toxicities associated, that just makes sense. And then the second one is around data transparency. So the work that we do is often based upon secondary analyses of data that's been collected in our hospitals, often for the purposes of clinical trials that have been funded by pharmaceutical companies. The patients that enroll in these trials have done so wanting to benefit future generations of people, and they want their data to be used to its fullest extent. And so that's what our group tries to do, which is around using the data. But from a perspective of being able to access it, we cannot access all of the data that we should be able to. And I guess from our local perspective, we are not leading the way in promoting data transparency. Europe and Canada, not America, but Europe and Canada are quite clearly well in advance of advocating for better data transparency by the pharmaceutical industry. So that would be my message to the health minister. And if he wanted to get more information on it, I'd be happy to give it to him.
Yeah.
But what advice would you give to patients diagnosed with HER2 positive breast cancer and their families?
Well, HER2 positive breast cancer used to have like quite poor prognosis associated with it. If you go back 20 years, 25 years, 30 years, but nowadays it's improving. The survival rates are good, and as we said before, newer and newer therapies are coming out. So it's not a death sentence that that used to be when we didn't have all these targeted therapies going on, but now we do. Again, it's still pretty horrible, but the survival outcomes are improving, and now there is this focus on quality of life as well, and hopefully we can sort of treat the patient, and newer therapies are coming out, and just keep supporting them. That's my advice to families, keep supporting them, because we said, there's other domains physical well-being, emotional well-being, social well-being, functional well-being. All these domains can be helped by the family, just make that easy for them. But yeah.
Well, I guess it's just reiterating that there are many available treatment options, and many of them have been shown to be quite effective. So it's obviously not a diagnosis that anyone wants to have, but it's just making people aware that there are treatment options, and for the right individuals, they work quite well, and then there are support mechanisms out there for people to be able to communicate, particularly if they're not feeling the best. I guess even part of what we had in our research is just showing that whether it's correlated or not, a patient's kind of emotional status and how they're feeling and how well they're functioning and how well they're moving, that can actually make a difference to survival outcomes. So there's many treatment options available, and a positive attitude is something that does help